Hi loves, welcome back again to my channel. Woo! I'm sorry guys, I'm super duper excited. For those of you who don't know, yesterday was my birthday. It wasn't really extraordinary, it was like a normal day, but my friends, my family, I didn't put it out there, so my YouTube family didn't know, but you can still wish me a happy birthday. Okay, so today's video is going to be about the things and the kind of questions you have to expect when you're going for a nursing interview in Ghana. So for those of you who don't know, I'm a nurse by profession, and I made a video about my struggles in getting an admission into a nursing training school in Ghana. So if you've not watched that video, I'm going to link that video down below. Please go check it out. So when you're going for a nursing interview in Ghana, it doesn't matter the school you're going to, you all use the same format and all that. So the first thing they look out for is appearance, how you look. You don't want any mini skirt or exposing things. Trousers is a no. Maybe office trousers, I don't know, the one they wear with a coat or something like that. I think that would be okay, but I've not seen anyone wear it, so don't say that because I said trousers. Well, I don't know if it has changed, but sorry, normally you wear skirts with a nice top or a decent straight dress. It could be African print of any color, like so far as you are comfortable and you're confident in it. It's not too short, it's not too long, and you feel nice. I think you can wear it. And okay, so during our time I think we were scored according to like how articulate you are, your confidence, current affairs, um your, is it altitude or something like that. I'm sorry guys, I've forgotten. But so before you go into the interview room, I think you pay your fee. Like they have some amount of fee you pay. I think it's 100 cedis. I don't know if it is still 100 cedis, but you pay, like they will take all your particulars. You be arranged according to how you came in. I think first come first serve, something like that. It differs in different schools. So I think you go in one by one. So when you get inside the interview room, you greet, you wait until you are offered a seat, and you sit down. And with the sitting down, you go and sit down and cross your legs, like your hands has to be on your thigh with your feet flat on the ground. Like you don't have to be, you see, sometimes when we get there, because we don't know them, like we are super nervous, you tend to be shaking and all that. But when you get into the interview room, I would advise that you sit down with your foot like on the floor, like it has to be flat, so that like they won't perceive that you're nervous. And in as much as you're nervous, don't show your nerves. Like they pick on that. Don't show your nerves. Like you're nervous, yeah, whatever. When they ask you the question, don't, you might know the answer to the question, but because you're nervous, you might forget. So yeah. So the second tip I'll give you is, like, when a panelist asks you a question, you look straight into his or her eye and answer the question. Sometimes they tend to confuse you a little. Like panelist one will be asking you a question, in the process of answering, another person will ask you another question. You have to look at the person. Like you finish asking, when, like, I don't know how to put it, but because you're answering this one, answer the person, go back to the person, answer the person. Like they just want to see how you, like, you be able to deal with it within that second or within that time. And please, even if you don't know the answer, don't go and say no idea, no idea. at least make an effort. Sometimes they just want to know if you, even if you don't know, like, answer the question with confidence. They look out for confidence a lot. So my second tip, the third tip, sorry, these are some likelihood questions they can ask you. Tell me about yourself. You rattle it, back, 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 back movement. You give it to them. ABR, why do you want to be a nurse? You give them the reason why you want to be a nurse. Why did you choose this profession? And you give the explanation to it. Why? I think sometimes you do ask it in like, why nursing, and you also answer it. What are some qualities of a nurse? What, and sometimes they do ask that, what qualities do you have to be a nurse? It's the same question. You just give, maybe I'm respectful, I'm humble, I'm compassionate, I'm empathetic, all those kind of stuff. And sometimes they do ask you, you should relate the subject you like, the course you did in secondary school to nursing. Let's say if you did CRS, general no CRS, history, literature, French, depending on what you did, sha, you just relate it. So let's say if it's CRS, like moral values, you can chip in the moral values into nursing or something like that. And I think another question they tend to ask a lot is, yes, ministers. You have to know your I think your consequence. This word. I think the area you live in, your MP, your hometown, like regional. I think regional minister or something like that. Minister of health, deputy minister of health, some departments in the hospital, you mention them, you explain. And they can ask you, why did you choose the facility, let's say the institute you chose. So ABI, you chose I don't know, I don't want to use the school name. Let's say you chose Tamara Nursing School. Why did you choose Tamara Nursing School? You give an explanation. Like that one, it has to be vivid. It has to be believable. If not, they'll know you're lying. You see? And I think another question is like basic things you should know. And I'll advise that you read a lot about coronavirus, hand washing protocols, social distancing, all those kind of stuff. You have to be current. I'll advise that the morning before your interview, you listen to the news, what is going on. Sometimes they'll tell you, they can ask you, what was the headline for today's news, or in the graphic. It's a stressful thing, I wouldn't lie, but I think that the fact that you've been able to make it to that, like you've been able to make it that far, means like you can achieve all your dreams. And mind you, nursing is not easy. I just want to clear that thing out. People think it's easy, like when you get an admission, you're going to learn how to give injection. My sister, that's not what we do there. We learn sign language, we learn French, a whole lot. So I wish you all the best, and I hope that your respective schools that you are hoping to gain admission to, they pick you. And please be confident. Don't let anyone bring you down. Do you. So I'll end today's video here. I hope you enjoy it. Thank you so much for watching. Don't forget to subscribe, like, comment. Please share my videos. And if you like content like this, don't forget to give it a thumbs up. Yeah. See you guys. Bye.